Morning all, my name's David Powers. Thanks for coming along today, and thanks Annalise and Dan for inviting me. I'd be a liar if I said I wasn't a little bit nervous, but let's go for it. Anyway, my talk today is called Osteopathy: What, How, Why and the Importance of Maintenance. So, essentially today is my 15 minutes of fame. I've split it into roughly 5 areas: an introduction, some explanation and answers, what I do, and then probably most importantly how it can help you, and lastly I've got a bit of an offer to give to you. Anyway, let's get on with it. Let me tell you a little bit about me. So, I graduated in 1996 from a place called the British School of Osteopathy. At the time there were only 3 colleges in the country where you could train. The British School of Osteopathy, the BSO, is meant to be the best. Nowadays there are probably 7 or 8 places you can train. It's still meant to be the top, if not one of the top places. So I was 22 when I graduated. I then went out and I worked in a couple of local practices and a couple of practices out in Essex. So essentially I learnt my trade working for other people. Then about 15 years ago, my practice here at Copthall came up for sale. There was another osteopath here before me. She sold the practice. I was living locally, so I bought it. Since then, I've expanded a little bit. I've taken on another osteopath and I've got a masseur who works with me. So I work 3 days a week: Monday, Tuesday, Thursday, and then on Saturdays I treat horses. Now, horses are what I always wanted to do. I wanted to be a horse osteopath. Probably in the run-up to making the decision to do osteopathy, my choices were either veterinary medicine or osteopathy. And at the time I was doing biology, chemistry, physics, GCSEs and then A-levels, and essentially I wasn't a straight A student. I was more of a B-C level student, so I ended up going down the osteopathy route. And I started initially on people in 1996, as I said, and then I did some more study and did more practice working on my own horse, and probably for about the past 16-17 years I've split my work roughly 75% human to 25% equine. Longer term, I think I'm going to increase the equine and decrease the human. Anyway, so what is osteopathy? Well, one of the descriptions I've got of it is: osteopathy is a method of assessing, treating and preventing a wide range of health problems. Osteopaths use a combination of movement, stretching, massage and manipulation of a person's muscles and joints to improve function, relieve pain and aid recovery. Where did this start? Well, it started in the late 1800s by a physician and surgeon, a guy called Andrew Taylor Still. He was basically disillusioned with medicine at the time and the harm it caused the body, and thought that there was a better way of improving health, and that was by working on the function of the body. So yeah, it started back in the 1800s and seems to have grown and grown since then. What can it be used for? Who is it for? Well, lots and lots of things it can treat. I spend my day treating mainly backs and neck problems. That's because people assume that all I really do is backs and necks. But I treat shoulders, elbows, wrists, knees, ankles. You name it, I've done it. I even do the occasional jaw, so the temporomandibular joint. Age range. I reckon probably the most popular age for people coming to see me is early 40s onwards, but I've got some patients as young as 6 and up to early 90s. Got a little old lady I go out and see in West Hampstead quite regularly, and yeah, she benefits greatly, her osteoarthritic hip. So what does the treatment consist of? Well, it's a combination of what you'd best understand as massage. in conjunction with what we call articulation and manipulation. So articulation is movement of a joint, and manipulation is the clicking that osteopaths are famous for. So a little bit like cracking your knuckles, that's similar to what I do to the joints in your back and neck. Now, the purpose of it is to increase the range of movement and to decrease the neural input from the brain down to the actual vertebral segment. So essentially, I'm improving the function. One of the common questions I get asked is, what is the difference between osteopathy, physiotherapy and chiropractic? Well, probably an easier way to answer it is, what are the similarities? We're all described as primary healthcare professions. We all train currently to either honours degree or master's level. Osteopaths and chiropractors train for 4 to 5 years, physios for 3 years. Osteopathy and chiropractic are mainly hands-on. So when you come in and you have treatment from someone like myself, you'll end up lying on my table and I will be doing something to you. Very similar with chiropractic. Physio is a little bit different in that physio's treatment tends to consist more of rehab exercises. Now, that is a bit of a generalisation, and there's quite a lot of overlap between the two, to be honest. Certainly as time goes on, I prescribe quite a lot of exercises to my patients so that if they do the exercises, they minimise the amount of time they come in to see me, and obviously the amount of money they have to spend for treatment. So, how can osteopathy help you? Well, in the UK, the National Institute of Clinical Excellence actually recommends osteopathy as a treatment option for non-specific low back pain. Some GPs refer. I've got a couple of GPs who refer to me quite regularly. Most medical insurers cover osteopathy. All you need to do is ring them up, say you'd like to go and see the osteopath. You either give them the name of one you know, or you ask for a list who are accredited with them. The insurer will then give you an authorization number and tell you how many sessions you're actually allowed. Early treatment is proven to improve outcomes. Most patients can see an osteopath within 48 hours. That's a bit different to seeing your GP, isn't it? Well, I don't know about your GP, but every time I try and get in to see mine, it's like a week or 10 days away. That just seems a bit mad to me. Most patients report an improvement in their symptoms immediately after their first treatment, and it's very, very safe. But there's only between 1 and 2 patients in 100,000 will experience a major adverse event as a result of osteopathic manipulation. So, how can you help yourself? Well, some obvious stuff. Travel as light as possible. Avoid carrying overloaded suitcases. Use wheeled cases or trolleys whenever possible. When lifting, keep the load close to your body. So, bend your knees, keep your back straight. Avoid lifting more than you can comfortably carry. Get help with heavy loads. Twisting or lifting awkwardly will increase the risk of hurting your back. Don't spend too much time sitting. I imagine most of you have heard the old adage now that sitting is the new smoking. Leave plenty of time to catch transport. Rushing increases the likelihood of injury. So, that's most of the basics, but more importantly, what do I actually do? What happens to you when you come in to see me? Well, the initial visit lasts about an hour. When you first come in, I'm going to take some basic details. Name, age, date of birth, height, weight, exercise levels. These are probably what most of you would expect anyway. But then we go on to the case history. So the case history involves asking about your problem. Where exactly does it hurt? Is it one spot? Is it a general area? Does it spread? Is there pain, pins and needles, numbness, tingling, anywhere else in the body? What I'm trying to do is I'm trying to narrow down the actual structure causing your symptoms. How long have you had the problem? How did it come on? Was it there suddenly, or was it a gradual thing? Has it been there days, weeks, months? So all of this helps me build up a picture about the problem and about what I can do about it. After that, I go into a bit more depth about what else is going on inside your body. So, have you had any accidents? Any illnesses? Any operations? Any of these could actually contribute to the problem you have. What's an example? Let's say you've had surgery on your knee in the past. Now, quite common surgery is a thing called arthroscopy, which is where the knee is actually cleaned out. But that cleaning out of the knee changes the function of the knee. So the knee doesn't function quite as well as it did before. So you then come in to see me with hip and low back pain that's been niggling in the background for quite a while. Now it may be that me helping the hip and low back, I need to actually work on the knee as well to give you some rehab exercises, to give you some stretching exercises. Okay, so that's the initial talking part of the initial consultation. Then I'd get you to strip down to your underwear. Now, if you don't feel comfortable stripping down to your underwear, that's fine. A pair of shorts or sports bra for ladies, that's absolutely fine. But if I grabbed someone from the audience and they would come up, first thing I'd have noticed is how they actually get up from the chair. Did they get up easily? Did they weight bear more from one side to the other? Did they push up from one side? My observation of that patient's movement would actually have started the minute I met them outside my door, as I shook their hand. How did they walk towards me? Were they wincing? Were they in obvious pain? Were they limping? Were they dragging a leg? Is their head held forward? Lots of little points that I'm taking note of. So, we've gone past that. Someone is standing in front of me. So my initial observation actually starts from behind. And the first thing that me personally is looking for, I'm looking for levels. So I'm looking for the level of your ears, okay, the level of your shoulders, top of your pelvis, and your feet. What I want to see in an ideal world is if I drew a line across all of those points, okay, those lines would all be parallel and they'd be parallel to the floor. So you've got to remember this is an ideal world. It doesn't quite work like that in the real world. In the real world, we're often all a little bit twisted, a little bit wonky, so we might have one shoulder low and one side of our pelvis high, and our foot may roll in on one side, so we have a flat foot. But small degrees of change up and down are perfectly normal. But when you see someone with quite a marked difference, it has a knock-on effect into the spine and can cause a thing called a scoliosis. So, from my observation here, I then go on to what's known as active movements. So, active movements, if we start with the neck, I'd ask them to drop their head forwards, back up to the ceiling, back to normal, look left, look right, back to normal, left ear to left shoulder, right ear to right shoulder. Okay, we then move on to the trunk. So the trunk consists of predominantly the thoracic spine and the lumbar spine. Similar movements. They bend forward. This is known as flexion. They come up. They lean back as extension. Then to the left, side bending left. And the right, side bending right. And I may even see rotation both ways. So what I'm looking for is range and quality of movement. So if I simplify it, if you imagine that a joint, any joint, should move from here to here. So I want a good range of movement. Now that range of movement might be reduced, it might actually be increased. But I also want a good quality of movement. So I want it to move from here to here well, like that, okay? Not like this, not like a door that's stuck. So from the active examination, I then move on to the passive examination. Now this is where I will physically move the individual vertebral joints, either starting up at the neck or down at the low back, sometimes even the feet, and working my way up. You normally compare and contrast. So if the problem is on the right side, I'd often start on the left, what's classed as what you'd assume is the good side. So from my findings on passive examination, I'll then explain to you which tissue I think is causing your symptoms, what the overall problem is, what I can and what I can't do about it, and roughly how long it's going to take. So then I'll treat you. So as I said, initial session takes about an hour. Follow-up sessions are similar, but are shorter, only about half an hour. So, why should you come and see an osteopath? Since the title of my talk is actually the importance of maintenance. Well, do most of you go to the dentist here? I go to the dentist, I see my hygienist every few months, I see the dentist every 6 months. But every 6 months I don't have anything wrong with my teeth. I can't remember the last time I actually had anything wrong with my teeth. And I'm pretty sure it's because I stay on top of it. How about another analogy? What about your car? Is your car important to you? I imagine most of you have got cars, so I imagine most of you have probably driven here today or been driven here. Now, if your car doesn't work, that has a knock-on effect on your life, what you do, whether you see your kids and your grandkids. So I imagine most of you take your car to the garage to be serviced. Again, that's something that I do regularly because I use my car a lot, drive from home here and then out to see horses. So essentially, prevention is better than cure. Anyway, I think that's probably enough of me talking for today. I mentioned that I have an offer for you. An initial consultation and treatment and a rehab plan with me is normally £60 for the first session. Today, I'm going to give you that initial consultation, examination, diagnosis, treatment plan, rehab exercises for half price. You need to have booked it by the 4th of July. Anyway, thanks a lot today. Any questions, either see me after, pick up one of my cards, or come and see me. Okay, alright, thanks a lot. Cheers. Bye-bye.